Welcome to Nutritional Frontiers sales training. For those of you that don't know, we hold our sales meetings every Monday morning, or sorry, Friday morning. Feels like a Monday. Every Friday morning at 9 a.m. And at the request of some of our practitioners, we decided that we would open up our training a couple of Fridays a month to allow you guys to listen in and get more familiar with our formulas and protocols and how we're instructing our team to use them in the field with your teams and practices. So we're really excited this morning. Dr. Len's TikTok is about to come on. Now, come on, you gotta love that, right?
Mm-hmm. Great name. I love it.
We're going to talk all about Lyme's and different protocols. And there's a reason behind that. Dr. Len was doing some research, as he loves to do, and has looked to see that there's actually an anticipated increase and outbreak that's expected in terms of the tick populations in a lot of our states where our practitioners and their patients reside. So we thought it would be a great topic. It also relates to our quarterly focus. If you don't know what our quarterly focus is, Mike Gallagher to my left will be happy to share with you what it is.
Yeah, absolutely. Good morning, everybody. So allergies, of course, hopefully everybody's doing the Air Max challenge right now, but we also have cardiovascular, with blood pressure and overall heart function and heart benefits. And then last but not least, pain and inflammation. And typically if you have Lyme issues, there's a lot of pain inflammation. So Dr. Len is going to really put it all together with some cutting edge new research that's never been discussed before. So super excited about this.
Absolutely. Thanks, Mike. Yeah. So if you want to find out more about our quarterly focus, our incredible duo of Jamie Dorley and Joe Messino, known as the Jamie and Joe Show, which will be live here later today at the World of Wellness because it is Wellness Weekend. But they have developed videos on our 3 quarterly focuses. And what you'll note is that we're trying to take our 12 wellness solutions and focus on them each quarter. So we take 3 each quarter that we bring to you. So hopefully we'll get through all of those by the end of the year, unless somebody miscounted, but I think we're on track. All right, so without further ado, I'm going to turn the program this morning over to Dr. Len. Dr. Len, do it to it.
All right, TikTok. I love it. You came up with that name.
I did.
That's what we're going to do. Now, first of all, I need to thank Mike Gallagher for his insight on this. We had a chance to talk numerous times about Lyme's disease and ticks. Dr. Darren Mitchell down in Houston, a great biochemist that I like to talk to, gave me a lot of different insight. Dr. Brandon Hannon, who does a principle called Cell Gym, and we heard from him about oxygenation and how that can help with Lyme's. Dr. Lisa Kellerman got some testimonies we're going to hear from a little bit later today. And lastly, I want to say a special thank you to Brad Paisley. Brad Paisley took this subject and created a #1 country western song. Anyway, his song is "I'd Like to Check You for Ticks." But anyway, here's what I want to do. I'm going to go through some basics on Lyme's disease and ticks, just so that we all understand. Now, why are we talking about this? Because according to the CDC, this is the 2nd most important emerging disease in the United States, behind diabetes, ahead of cardiovascular disease. So the 2nd greatest emerging disease. Now, why are we doing this now? Because of the excessive moisture that it's been in the Pennsylvania area with rain. Down here in Florida, the excessive dryness on either end of the spectrum, you see ticks go crazy. So we're having an issue where now the state of Pennsylvania is the 2nd highest in Lyme's disease, behind the state of Maine. But it's guesstimated, when you look at the research from the CDC, that nearly 18 to 20% of people who live in the state of Pennsylvania, if they are tested, will test positive for Lyme's. Put that into perspective. 20% possible in the state of Pennsylvania would test positive for Lyme's. Now, does that mean they're having a lot of symptoms? Maybe not. But yours truly, going back 8 years ago, managed to get 18 different tick bites in one day. And I test positive for Lyme's every single time I'm tested. Now, did I have complications? No, because back 8 years ago, I needed to figure out a way to treat this. And I have. So what we're going to do today is go through some of the basics of Lyme's. I managed to put together, with Mike's help, a lot of different protocols using a lot of different products. Now, all this information that I have here, I'm going to get over to Christine. So just listen up right now. I've got studies after studies after studies. We're not going to go through all of them, but hopefully we'll have a chance to get into these in depth. Okay, here it is. Tick season's here right now. It's peaking in the next 2 or 3 weeks. The contract of ticks and the possibility of not only bacteria, but also viruses and other parasites being passed on by tick bites. So what are the types of tick-borne diseases? There's many types. The most prevalent one in the United States includes cases that the CDC says, which is called Lyme's disease. So far, reported cases of Lyme's disease last year were nearly 500,000. That's reported cases. Their guesstimation is anywhere between 2.5 and 3 million cases went unreported. So this is a rather large issue. So for those of you that are practitioners, this is an area that most of us just sort of ignore at times. Or maybe we'll see that occasional person that comes in and says, I've been diagnosed with Lyme's disease. What do I do? Now, there are other situations called anaplasmosis, babesiosis, ehrlichiosis, and Rocky Mountain spotted fever. Now, what are the symptoms and early signs of any tick-borne disease? Fever, chills, headache, muscle aches, pain, and a critical one, nausea and vomiting. So let's look at Lyme's disease first. Apart from those symptoms listed, the most characteristic symptom of Lyme's disease is a bullseye, sometimes appears with that fatigue. Anaplasmosis, real quick, usually appears 1 to 2 weeks after the infected. It's painless, may go unnoticed. Symptoms are mild to moderate. Rocky Mountain spotted fever, the most dangerous type, includes fatigue, loss of appetite, and a rash after incubation periods of 3 to 12 days. Skin rash starts as spots on the wrist and ankles. On the wrist and ankles, this is a critical point of this, spreading to the trunk and sometimes the palms and the soles of the feet. Ehrlichiosis, after an incubation period of 5 to 14 days, discomfort and diarrhea typically follow that. Babesiosis, this is usually no symptoms to being life-threatening. Approximately 25% of infected adults and 50% of children go asymptomatic. Compared with other tick-borne diseases, this has a relatively long incubation period ranging from 1 to 4 weeks after a tick bite to 24 weeks before it actually shows itself. So what causes a tick-borne disease? All tick-borne diseases are caused by pathogens transferred from a tick due to a tick bite. Though there are different kinds, and again, the most common being the Western black-legged tick, western part of the United States, and here in the East, Eastern black-legged tick or the deer tick. Among tick-borne diseases, Lyme's disease is the most prevalent, usually caused by that black-legged tick. It's a parasitic spirochete. Lyme's disease is named after Lyme, Connecticut, where it was diagnosed as a separate condition for the first time, not back in the 30s and 40s, not in the 50s, but in 1975. And it was actually diagnosed and brought to the table by a doctor by the name of Willy Bergdorfer, the Lyme's microbe discoverer, who at that time believed the disease was the result of a botched military experience. He wrote a book called The Secret History of Lyme's Disease as a Biological Weapon. Think about that for a second and think of all the controversy that went on with COVID. And when I was talking to Mike this week, we talked often about how the increases have been seen every single year up to 2021 and 2022, when all of a sudden COVID was there and this got pushed on the back burner. But we still feel that the issues dealing with COVID sort of masked how many people actually still had a problem with Lyme's. Here's a big question for everybody. Who's at risk? Who's at risk for tick-borne diseases? In other words, what part of your population, what part of your participants, what part of your patients are at risk? University of California, Davis. First study I'm going to bring out today. Lyme's disease bacteria takes cover in the body. It hides most commonly in the lymph system. The bacteria that causes Lyme's disease appears to hide out in lymph nodes, triggering a significant immune response, but one that is not strong enough to rout out the infection. University of California, Davis. They said this is where this organism can typically hide. So we're going to put it at the top of the list. Who's at risk? Somebody that would have lymph issues, lymphedema, issues with stagnation in the lymph system. So again, you can look at it from the perspective of saying, if you have somebody that's in that category, using the lymph drainage remedies, the homeopathics, can make an amazing difference of thinning out lymph so that they would eliminate most of the hiding spots. Outdoor workers like park rangers, landscapers, construction workers, those with MTHFR SNPs, SNPs, those that have at least one and even possibly two of those SNPs when we do those checkings, those that have a problem with methylfolate, those people seem to be at a higher than normal risk. Anybody with an inflammatory disease, as Mike had said, this is an interesting one. Young females with polycystic ovarian syndrome seem to be at a higher risk factor. So again, there's a great grouping there of people, outdoor enthusiasts, people living in epidemic areas such as Pittsburgh, Harrisburg, Philadelphia, and the Allegheny Mountains. Owners of pets and livestock. Animals such as cattle, cats, and dogs can carry ticks, increasing the risk of tick bites for their owners. And lastly, immune-compromised individuals, people with weakened immune systems, such as those undergoing chemotherapy, organ transplant, or dealing with other immune-compromised diseases, such as rheumatoid arthritis. I'm not going to spend a lot of time going into this because I really want to spend time on the protocols, but how are tick-borne diseases diagnosed? Following tests can be used. One's called a polymerase chain reaction, a PCR amplification. A positive PCR result's helpful, but this is a critical factor. This is the most common test that's done along with a Western blot. A negative result does not rule out the diagnosis. So even though it's there, 50% of the time, the test itself misses it. The other one's called an IFA test, indirect immunofluorescence antibody test. It's performing an IgG IFA test. When you become sick a few weeks later, they do that test. They can do a blood smear microscopy. They can do a skin biopsy. They can do a DNA test. I had the skin biopsy done. Two of the ticks that took place on me took refuge in my calf muscles. I had to go to a dermatologist to have two of them actually surgically removed. And then they did the skin biopsy to diagnose the Lyme's on me. So what are the complications of tick-borne diseases? Anaplasmosis in rare cases. Delayed treatment or concurrent medical conditions can lead to severe illness, respiratory failure, bleeding issues, organ failure. And I'll throw this word out. It's not very common, but death. These kind of things are not just a rash or an allergy. These can become very serious. Rocky Mountain spotted fever. If not treated in time, patients will eventually suffer coma, nerve death, brain swelling, breathing difficulties. Ehrlichiosis, severe complications, uncontrolled bleeding, seizures, and coma. Babiosis, serious complications, usually seen as acute respiratory failure. So, that being said, we should all agree that Lyme's disease isn't something just to put on the back burner. It's something that needs to be looked at, paid attention to, and we're going to look at what are some of the common treatments. What are the common treatments that come out of traditional medicine? If you get bitten by a tick, remove it immediately. Use clean tweezers or a tick removal device. Now, they say, it's an old wives' tale, but covering the spot where the bite took place once you do the removal with clear nail polish can stop it from getting any worse. However, those that have been told to use petroleum jelly, alcohol, light a match and burn it, or other irritants are completely ineffective and should not be used. They can actually cause the tick to regurgitate, worsening the odds of an infection. So all those old wives' tales, put on the back burner. After a tick removal, clean the bite area, keep the tick in a sealed container and note the date and location of the bite. They're very difficult to kill if you haven't seen that. So what are some of the things that have been documented to help as treatment? Now, we're talking here about treatment for Lyme's disease. I'm going to go through a number of these. We're going to spend a lot of time on coenzyme Q10, and then we're going to come up with some protocols for you. Number one, astragalus, often used with other herbs as a dietary supplement for various conditions such as respiratory infections, allergic rhinitis, asthma, chronic fatigue, chronic kidney disease. Moderately effective, almost as effective as half of a dose of doxycycline. That's pretty powerful. Now, check it out in Immunomax. One of the key ingredients in Immunomax has astragalus. Ashwagandha, also known as Indian ginseng. Ashwagandha is a crucial herb in Ayurvedic medicine. It boosts brain and nervous system function, supports reproductive health, strengthens the body's ability to handle stress. Ashwagandha. Where does that show up? Thyro Complete. It's in there as a trademark product called Sensoril. I don't think too many of us would think of using Thyro Complete as a supportive protocol if you have somebody diagnosed with Lyme's that's also on a thyroid med. Think about that from milk thistle, Silybum. Milk thistle may be used as a dietary supplement for hepatitis, cirrhosis, jaundice, diabetes, indigestion, and other conditions. Again, look at Live Complete. Amazing. Korean ginseng or Panax ginseng. Highly effective. And a 2021 study tested ginseng with strong effectiveness in test tubes against this organism, the parasite that causes babiosis. Where do you find that ginseng? Adrenamax. So again, thinking outside of the box of saying, I have somebody that tested positive for Lyme's, that is suffering from fatigue, and we did other treatments along the way, but I still have the fatigue of adding Adrenamax into the scenario to, again, take advantage of the ginseng to keep everything down. Sweet wormwood, Artesima annua. 250 milligrams is the therapeutic dose for a kill ratio on this organism. Where do you find sweet wormwood? Parakill. Think outside the box. We think of parakill for a lot of other uses. It can be used here. Here's an interesting one. Japanese knotwood, Polygnum cuspidum. Where do you find that? Fertility. Now, we found, as I mentioned in the very beginning, that young ladies with hormonal difficulties, longer than normal cycles, tough cycles, difficulties along the way with their periods, adding fertility, properly dosed, can be effective of also keeping the Lyme's in check. So again, 2023 computational investigation exploring those 9 natural compounds for their effectiveness against the harmful Babesia parasite in humans found that they gave great potential. Now, number 2, those are some herbs that can be used. Nitric oxide releasing therapy. Nitric oxide is a gas our body uses to fight harmful invaders like bacteria, viruses, and parasites. It helps immune cells communicate and produce chemical reactions that kill these pathogens. A 2021 cell culture study developed that NO significantly reduced the attachment of the Rickettsia bacteria by disrupting energy processes. Nitric oxide releasing therapy. Where do we find this? How about a prep that's on the quarterly focus right now called CircuCore? You have CircuCore in at a twice-a-day dose, building nitric oxide levels in the body to make sure that we do keep Lyme's in check. So how can I prevent tick-borne diseases? Number 1, avoid tick-prone areas, avoid soil, woody, brushy areas, stick to the middle of trails when walking, avoid sitting directly on the ground, trim your shrubs and trees, establish a 1-yard wide barrier using wood chips, mulch, or gravel between your lawn and wooded areas, seal the opening in stone walls to deter deer and rodents from entering your yard. All of those pretty well understandable. Is there anything that can repel ticks? I'm not a fan of DEET, and traditional medicine would say, yes, spray yourself before you go out. I have found that oil of lemon, oil of eucalyptus, natural repellents that have worked extremely well against ticks. Shower and bathe soon after coming indoors, preferably within 2 hours. Tumble dry your clothes on high heat in a dryer for 10 minutes to kill ticks. Ticks will survive washing cycles. Let me say that again. Ticks will survive a washing cycles if they're on your clothes, but they will not survive 10 minutes in a dryer. Okay, now I want to move now to a study. And again, I'm going to fly through these so that we have time for some questions in the end. Lyme's disease. This comes from the journal called Antioxidants, April 11th, 2022. Lyme's disease, a role for coenzyme Q10 supplementation, ? Lyme's disease results from a bacterial infection following a bite from an infected tick. This article goes on to say, listen to this. In this article, we review the potential role of supplementary coenzyme Q10 in mediating the pathogenic mechanism underlying Lyme's disease on the basis of its role in mitochondrial functioning, as well as its anti-inflammatory and antioxidant actions. As you read into this article, you'll also find methylation become mentioned numerous times. The concept of using NR-CoQ10 to add DMG, dimethylglycine, together with coenzyme Q10 as a therapy. Now, I'm going to go into a few more things. Coenzyme Q10, fighting fatigue. Lyme's disease patients experience extreme fatigue together with diminished cognitive function and musculoskeletal pain. Dosing coenzyme Q10 in the 300 to 600 milligrams per day dose has made an amazing change in the fatigue side. It works by increasing mitochondrial functioning. Mitochondrial dysfunction has been implicated in the pathogenesis of both the chronic fatigue and the fibromyalgia kind of aches that seem to come with Lyme's disease. Next, coenzyme Q10 and inflammation. Following the initial entry into the skin, the bug agent seems to possess the ability to induce persistent inflammation within the human host. This may be the result of the presence within the bacteria of strong pro-inflammatory lipoproteins, which are capable of the induction of nuclear factor kappa beta. You're going to hear in the protocols the importance of using SPMs as a therapeutic entity here from the get-go. And I'll go through that protocol toward the end. But coenzyme Q10, important. Next, Lyme's disease and oxidative stress. Evidence for the role of oxidative stress in the pathogenesis of Lyme's disease has been obtained from several clinical studies performed on patients that have not been treated with antibiotics. A study by Dr. Peacock and his group found out mitochondrial superoxide levels were found to be significantly higher in the blood of Lyme's disease patients and has been calmed by 600 milligrams of CoQ10 every day. The end of this article says CoQ10 supplementation, safety, and the extreme importance of formulation types. And it goes on to say you must stick with pharmaceutical standards rather than food supplement standards. Monitoring CoQ10 status in Lyme disease patients in view of the evidence of oxidative stress and chronic inflammation, together with the implication of mitochondrial dysfunction associated with Lyme's disease, the possibility arises that patients with this condition may have some underlying coenzyme Q10 deficiency. All right, let's stop there for a second. How many patients do you see that come into your office on a statin drug that are going hiking? Could they be at a higher than normal risk? Could it be that if you correct their coenzyme Q10 levels, you help them fight this off so it doesn't become a problem? I'm going to share this article with Christine because attached to it are 55 other articles dealing with natural supplements and the use in Lyme's disease. Next, this comes from the Journal of Frontiers in Immunology, November 11th, 2020. Quercetin and vitamin C, an experimental synergistic therapy for the prevention and treatment of Lyme's and SARS-CoV. They added this together in the Frontiers of Immunology. They said this: buffered ascorbate is a critical vitamin necessary for correct functioning of the immune system. It plays a role in stress response and has shown promising results when administered to the critically ill. Quercetin is a well-known flavonoid whose antiviral properties have been investigated in numerous studies. There is evidence that vitamin C and quercetin co-administered exerts a synergistic antiviral, antibacterial action due to overlapping its efficacy. This article goes on to say, could this be one of the most important ways that we can start to fight this? Now, back 8 years ago, after I had all the ticks removed from me, I took a 4-day period of time where I took 1 gram of buffered vitamin C every hour while awake, along with 500 milligrams of quercetin, 2 capsules twice a day for that same 4-day period. And during that time frame, almost all of my symptoms disappeared. Now, do I still test positive? Yes. Next article, free radical biological medicine. This comes from August 1st of 2010. This talks about Lyme's disease causing a problem in the aortic vessels of the heart, where we get inflammation of the heart tissue. Sound familiar to like COVID? And it says here, considering considerable epidemiological evidence indicates that dietary consumption of moderate levels of polyphenols like quercetin dihydrate decreases both the incidence of cardiovascular disease and the mortality associated with myocardial infarct that come as a complication of Lyme's disease. Molecular mechanisms of this cardiovascular protection remain uncertain, but certainly involves changes in the rate of nitric oxide generation. Buffered C, quercetin, Circucor. Think about that as a treatment protocol. We're going to go through treatments and protocols here at the end. Infectious immunology, October 1995, nitric oxide production during Lyme's disease, lack of involvement in host resistant or pathology. It goes on to say the role of inflammatory-induced nitric oxide during infection by the spirochete Borrelia. And it goes the addition of nitric oxide to cultures of this organism completely prevented its growth in lab. It says this is extremely important by boosting the nitric oxide production in the body, but what we just said could stop the pathological development of arthritis that typically occurs with Lyme's. These results that indicate that Bug4 is able to persist in the host when there is not the presence of nitric oxide. That actually comes out of Johns Hopkins. Now, this next article, Johns Hopkins Medical Lyme's Research Center. And it goes to this. In the study that was done at Johns Hopkins in 2021, participants with post-treatment Lyme's disease and controls were asked about presence and severity of 36 signs and symptoms over the past 2 weeks. They go through this whole list from irritability, low back pain, headache, dizziness, visual clarity, etc. And the article goes on and it says, what's our treatment protocol? It's Johns Hopkins again. First standard line of care of treatment for adults with Lyme disease is doxycycline, a tetracycline antibiotic. The use of antibiotics in Lyme's disease. Listen to this. This is the paragraph 2 after they say to use doxycycline 100 milligrams twice a day for 7 days. Using doxycycline during Lyme's disease causes the bacteria to evade the host's own immune system, ending up causing more complications than necessary. They go on to say this. Even when Lyme's disease patients were early diagnosed and promptly treated, 14% of the patients developed post-treatment Lyme's disease and had persistent functionally impairment symptoms 6 months to 6 years afterwards, those treated with doxycycline. Post-treatment Lyme's disease represents a research subset of patients who remain significantly ill for 6 months to 5 years following standard antibiotic therapy for Lyme's disease. And it goes on to say, sleep disturbances, depression, and cognitive problems end up becoming an issue. Why? Because we're now finding what came out of this study, whether we treated with doxycycline or not, this delay in diagnosis that typically happens allowed these entities to cause confusion at the brain level. And when you hear the therapy that Mike Gallagher came up with, using the brain boost prep, as one of the first lines to stop this from occurring. This is one of the worst side effects of doxycycline use in Lyme's patients. So what causes post-treatment Lyme's disease? The infection, obviously. Persistent bacterial infection, yes. And this is the one they say. Doxycycline initially causes bacterial debris. That bacterial debris can cause neural network alteration in the brain, which can cause sleep impairments, confusion, and issues like that. John Hopkins again, is there a cure for post-treatment Lyme's disease? Currently, no FDA-approved treatment for persistent symptoms in Lyme's disease. Therefore, treatments must be individualized by using more natural methods. That's what we're talking about today. Lyme's disease, let me see, the next article will say this. Transmission are spread through people through bites of these infected ticks. Deers are an important source of blood for ticks and important for tick survival. Deer are not infected with Lyme's disease and do not infect the tick itself. April through July. Why are we doing this right now? April through July, the tick nymphs are actively questing for hopes in the environment. Early spring and early fall, the adults are the most active. Lyme's disease is at its peak at the end of April into the beginning parts of May. There's no credible evidence that Lyme's disease bacteria can be transmitted through the air, food, water, or the bites of mosquitoes, flies, fleas, or lice. Now, that article actually came out in early 22. In the last 6 months, there's been numerous cases of mosquito-borne Lyme's. So even though that article less than 2 years ago said it wasn't possible, it is. So PBS did a special on this called Why Are Lyme's and Tick-Borne Diseases on the Rise? I got a chance to watch that. I took some notes, and it says, in North America and internationally, blanket-dragging tick biologists are uncovering an unsettling trend. Many tick species are expanding their ranges, swelling in numbers, and picking up new pathogens that can deliver disease to people that have these possibilities of getting bit. One reason to worry is because ticks are prodigious vectors. They bring more types of pathogens over to people from animals than any other creature, and they're on the march right now. In the United States, the annual number of cases of tick-borne diseases has roughly doubled since 2004 and quadrupled in the last 3 years. It goes on to say ticks come in two main varieties: hard ticks, which have visible mouth parts and a hard plate on their back, and soft ticks, which lack the hard plate and have mouth parts hidden on their undersides. Hard ticks can transmit an array of bacteria, viruses, and parasites from Lyme's disease, Rocky Mountain spotted fever, Colorado tick fever, babiosis, etc. Ticks are adept at transmitting diseases in part because they live a long time. I did not know this. Compared with other vectors like mosquitoes, ticks can live 2 to 3 years. I was relating to Mike the fact that back 8 years ago, when I had a number of ticks removed from me, 2 of them hung on my left bicep. Not like I have big biceps, but 2 weeks after the fact that I was treated, as I scratched those 2 little spots on my bicep, which I still have 2 scars, that little tick came alive. It lived on my bicep for 2 weeks. So I didn't treat that one properly. It didn't cause me any complications, but there was an issue there. Other issues called binders. This comes out of Dr. Klinghart's information coming out of Germany on how he treats Lyme's disease. Now, Klinghart's been known for chlorella forever, using heavy metal detox protocols. But what Klinghart came up with was a combination of hyaluronic acid, HA+. Listen to what it said here. In his research, hyaluronic acid teases microbes out of protected hiding places, nutrients for joints, and connective tissue. So again, and they say you must use the smallest Dalton molecular size for complete uptake of the hyaluronic acid. Now, I want to talk for just a minute about one of the complications that tends to come with this. Is called mast cell activation syndrome in infections. This also is seen commonly in mold toxicities. What is mast cell activation syndrome? Mast cells are immune system cells found throughout the body. In the past, in medicine, we thought they were only turned on to release histamine and allergic reactions. However, we now know that they are turned on by a host of other things other than strict allergies. And number one on the list was Lyme's and other tick-borne infections, and number two was COVID-19. So we knew that this was a problem with this histaminic release and the people that had breathing issues and allergies that went with this. How do we handle mast cell activation syndrome? I want you to think about it for a minute and think about Mike's Air Max Challenge. Borrelia has had an amazing way of coming together to be able to treat mast cell stabilization issues. I want to talk for just a minute before we go into some of the protocols about Pro-Reds. You know, there's a lot of different options you have with the powdered forms that Nutritional Frontiers have. You have purples, you have greens. We talked about the greens ad infinitum, and the oranges. But the Pro-Reds have some very interesting ingredients in it. Number one is choline. Vital choline is that part, 20 milligrams. It also has the milk thistle we talked about, has green tea extract, which we talked about, knotweed root extract, which we talked about, quercetin dihydrate that we talked about, larch Larcenia, the hardwood extract, arabinogalactones, NN-dimethylglycine, L-carnitine, and coenzyme Q10. When you're looking at something for that long-term support for people that have had Lyme's disease, adding the Pro-Reds in, and I'll give it to you in a minute on the protocols we came up with. Symptoms and treatments of Lyme's neuroborreliosis, the neurological complication of Lyme's disease in the brain. Lyme neuroborreliosis, also known as neurological Lyme's disease, is a complication affecting the central nervous system. It's caused by the spread of the Borrelia bacterium to the brain and spinal cord, causing nerve pain, numbness, double vision, facial palsy, and other symptoms. Symptoms can persist for months on end. Can be diagnosed a lot of different ways. Within 4 to 6 weeks of infection, between 10 and 15% of untreated people with Lyme's will develop this. Sudden high fever, stiff neck, severe headache, nausea, vomiting, confusion, disorientation. Cranial neuritis is the inflammation of the cranial nerves that originate in the brainstem. Lyme's radiculopathy, the nerve pain caused by inflammation in the spinal cord root. The limbs and the trunks are most commonly affected. How do you get around this? It's one of the reasons in the early protocols you put in the brain boost at a high enough dose so that you could stop this from happening. Journal of Infectious Disease. I'm going to do a couple more, then I'm going to get into the protocol. Genome-wide DNA methylation profiling in Lyme's neuroborreliosis reveals altered methylation patterns in these patients. Again, the Journal of Infectious Disease, April 15th, 2024. This was just less than a month ago. It says Lyme's neuroborreliosis is a complex neuroinflammatory disorder caused by Borrelia, Lyme's disease, transmitted through tick bites. Epigenetic alteration, specifically DNA methylation, plays a role in the host immune response during the infection. So this study goes on and on about Lyme's neuroborreliosis, and it says to make sure that we check for MTHFR issues and treat accordingly. Patent trademarked dimethylglycine as a methyl donator. For those that would be prone, that would have MTHFR disease, or those that have battled Lyme's and are starting to have some of the brain issues. Public Library of Science, 2014, serum inflammatory mediators as markers of human Lyme's disease activity. Chemokines and cytokines are key signaling molecules that orchestrate the trafficking of immune cells. This article goes on and talks about this. Are you ready? Specialized pro-resolving mediators in neuroinflammation from Lyme's. Overview of studies and perspectives of clinical application. You have a tool available to you for these kind of issues. One of the most common inflammatory things that occur in patients with Lyme's, using enough. And don't be afraid to use enough SPMs to fight this off. Last study for today, International Journal of Molecular Sciences talks about glycine, the smallest anti-inflammatory micronutrient. Glycine is a non-essential amino acid with many functions and effects. Glycine can bind to specific receptors and transporters that are expressed in many types of cells throughout an organism to exert its effect. There have been many studies focused on the anti-inflammatory effects of glycine, including its ability to decrease pro-inflammatory cytokines and the concentration of free fatty acids to improve insulin response and mediate other changes. Although glycine is a non-essential amino acid, we highlight how dietary glycine supplementation is extremely important in avoiding the development of chronic inflammation from Lyme's disease. Where do we find glycine? 500 milligrams in a prep called Calm Day. Now, hopefully you got from this talk the concept that a lot of the products that you're carrying, a lot of the products that you're using have a role here. This is where the practitioner kicks in. I'm going to give you all the ideas. And again, these are Dr. Len's protocols with the help of Mike and a lot of other people. But I'm going to give you these, and I'm going to send them to Christine. You need to mold these things to fit your particular patients. Here's a Lyme's protocol. This first one I'm going to call stir-up treatment. We know that it hangs out in the lymph system and in other parts of the body. So how do we stir this up? SPMs, 1 to 10 per day, depending on the level of inflammation. X-Flame, or what we heard about here from Dr. Klinghardt, HA+, 2 to 6 per day. For the brain neuritis, Brain Boost, 6 per day. Get involved with that right away. One of the most telling signs of Lyme's disease is the brain inflammation that occurs, and the confusion, and the dizziness, and the inability to handle bright lights. Immediate treatment, removal, treatment. Now, I'm going to show you this. A little known prep, I don't even know if you carry it in your office. Cinchona tincture. Cinchona is the source of quinine. If you look at how the rest of Europe and Asia treat Lyme's disease, they don't use doxycycline. They use quinine. They use quinine quite regularly. Now, quinine was taken off the market here for quite a while because of its cardiovascular issues, but cinchona, which has been known to fight COVID, has been seen here as 3 droppers a day, along with Parakill at 3 droppers per day, as an aggressive approach for 7 to 10 days after the first infection. Buffered C, as I mentioned, is what I use, 1 every hour while awake for 3 to 4 days. Quercetin dihydrate, 500 milligrams, 2 in the AM, 2 in the PM. Circucor, 2 in the AM, 2 in the PM. And really, really, really important, enter CoQ10, 1 in the AM, 1 in the PM. Now that's a lot. I understand that. We're talking about SPMs. We're talking about HA+. We're talking about Brain Boost. We're talking about Cinchona, Parakill. You got to mold these kind of protocols together for your treatment based on where the patient is. Long-term treatment, somebody that has been tested like myself, that wants to keep the symptoms down, enter DMG every morning. Dimethylglycine, make sure that that doesn't rear itself again. Immunomax, 1 capsule every day. Vitamin D3 5000, 1 to 2 per day. Mike liked this in his protocol, as do I, is using CBD not only to help with sleep, to help calm the brain, but to also reduce inflammation, 1 dropper full each evening. And then, as I mentioned earlier, if you're looking for 1 drink that can be supportive, the Pro Reds, 1 to 2 drinks per day. Now, if you have a patient that's having thyroid difficulties, such as fatigue, add the Thyroid Complete AM and PM along with their thyroid prep. If no thyroid issues, but having fatigue, add Adrenamax, 2 in the morning and 1 in the evening. If having cycling difficulties, such as PCOS, add fertility, 1 or 2 per day. If the patient comes in and you called them stressed out of their minds because of Lyme's, add Calm Day 1 to 4 per day. And if mast cell activation syndrome is in place and you're seeing a lot that goes with that, do the Air Max challenge with them and then dose accordingly. That's a lot. But again, we know Lyme's disease is going to be surfacing again, and this will be a record-setting year.
Well,
So,
Dr. Len, the good news is, even though that's a lot, most of what you're talking about is actually part of our quarterly focus, which means
exactly.
it's 15% off any of our cardio solutions, allergy and immune, and bone, joint, and inflammation. So I think almost nearly everything you mentioned should be available to our clinicians right now at 15% off. So that's a really, really good thing.
Now, Dr. Lisa was going to call in, and I think the one that we're seeing on here, Dr. Lisa, is that Dr. Lisa Kellerman?
Yep.
That's her?
I think we can have Dr. Lisa unmute and maybe even
Can
turn
we?
her camera on. I want to see her
Dr. Lisa,
beautiful
turn your
face.
camera on, and she is unmuted now.
Yeah.
Hi.
Hi, Dr. Lisa. Could you share your testimony? Mike and I were talking, and we used you as one of the examples of somebody that has had Lyme's disease and went after this treatment protocol, fine-tuned it to themselves, and is using it with your patients. So give us a little background on that.
So I don't know how to get this camera off. For some reason, it's not showing me, but that's okay. I'm here from Butler, Pennsylvania. Hi, everybody. First of all,
We love you.
love you, Christine. wish you could see me, but that's okay.
That's all right.
Both my husband and I have had Lyme. Talk about my husband first a little bit. Has his own lawn care company. So he's in the weeds, in the dirt, in the bushes, in the grass a lot. So both times he was probably on his knees somewhere and he was bit in the groin area. So he presented with fatigue, the bullseye, joint pain, lethargy, bad symptoms. So, went to the PCP, got on Doxy, a week, really wasn't getting any better much, a little bit. So, he just did that course, and then I took over with Nutritional Frontiers protocol, which is fantastic. So it probably 2-3 weeks, that's all it took for everything to go back to normal with him. Then, of course, a year later, he got bit again. So never had any other symptoms after doing the protocol. Now, of course, I still have him on the CoQ10, the CBD, and Immunimax, and the D. So I have him on a few things every day normally. That's what we do. But so we got bit again. This time he didn't want to do the Doxy, and he just did the protocol from Nutritional Frontiers, and everything was fine. And it's been probably at least 5 years now. No problems. No lingering anything. So when I got bit, I didn't even know I got bit. I just had the bullseye on my calf. So, little background, we're outdoor people. We bike, we hike, we fish, we swim, we have a camp. We live in the woods too. So I am not going to give up any sort of my lifestyle just because I might get bit.
Hey, Lisa, can I ask you a question? Can I ask you a question for a second? Have you and your husband been checked for the MTHFR gene?
No.
The fact that he keeps getting bit over and over again, and the research that's out there that says if you have that combined with any lymph stasis, where the lymph system's not moving, you tend to be more attractive to ticks. So you want to live outdoors where you all are doing. You may want to check and have an MTHFR. It's an inexpensive test to do. You can do a swab of the inside of your cheek. Just find out if you do have that, because oftentimes then adding a little bit more methylfolate can actually help you to repel ticks. And that's where I am right now. After I used to be a tick magnet, and now that I'm doing the proper levels of methylfolate, they don't bother me anymore. So they don't come after me at all. which
Oh,
is
that's
just a thought.
Great idea. Thank you. So back to me. I just developed a bullseye on my leg and I never felt a tick. But I think like you said, that they can sit on your leg and they can, be a little bit docile, and then you scratch it and then they revive themselves. So that's probably, I think I thought I had a mosquito bite, scratched it. Week later, I had this full bullseye, like probably 5 inches in diameter, bright red, bright purple, nasty. Okay, so I went to the PCP just so he could document it. And he said, do you have any other symptoms? And I said, no. And he goes, well, you know what to do. You go home and do what you need. If I'm here if you need me. So I went home and I did the protocol and it went away and I never had another problem. And maybe I'm even healthier now because we go, my grandson is 2 years old. We go out and we lay in the woods, we lay in the field and we have deer everywhere. So we've been really good, but a lot of people think if they just do the antibiotic, they're going to get rid of it. And that's not what happens.
And that's what the research has shown. Even when you look at Johns Hopkins, and they basically said the failure rate on doxycycline is about 80%. And those that have gone for these longer therapies, and there's been docs out there, I was talking to Mike about this, that back in the day used to treat doxycycline twice a day for a year. Can you imagine what that does to the gut?
Oh, yeah. One course can ruin it for 2 years.
Yeah. And, so when you look at the failure rate, you've got to look somewhere else. That's why I like this idea. And when I did talk to Mike and we went over this, it's like, you know what? This is something that needs to be shared with everybody in this country. Because if you're going to rely on going to your PCP and getting some doxy and hopefully that's it, it's all over with, it's going to linger in your system. And some of these complicating factors, especially the brain one and the inflammation ones, can be put on the back burner. I really like SPMs. I mean, I like the fact that SPMs can actually stir up and move it. If it's stuck in the lymph system, if it's over here, we can move it around, get it out, and allow your own immune system by stimulating it again with cinchona, paraquat, quercetin, buffered C, Circucor, Enter-DMG. All of those are effective. All of those that we think are, enter CoQ10. It's cardiovascular supportive. But guess what? It actually works to keep Lyme's in check and actually can help to deteriorate the Lyme's bacteria out of your system.
And I've had patients that I've had to do the paraquat with them too, because they have Lyme so bad, or they've had it for so long, they have parasites on top of it. So I've had to do the parasite program along with the Lyme program. And I have so many patients that have dealt with Lyme or undiagnosed Lyme for years. And once they do this protocol, they have relief, and they have no hope when they come to me sometimes.
I'll tell you what, I would get the cinchona in. I have it. I keep this stuff in every cabinet down here because I use it as a front line against COVID. And I'll tell you what, it is that and paraquat together. If you're just going to do some simple thing, they don't want to do a whole lot of different things. You want to just give them some response right away. Paraquat and cinchona together can make an amazing difference.
And even the children that come now that have Lyme, or they don't know they have Lyme, that protocol, we just vary it up for their age, get the dosage lower, and it works fantastic for the children too.
And we also see, and it's not in all the research, but those that are hypothyroid, those that are on thyroid meds, seem to be at a bit of a higher risk factor again. And that's why I liked the ingredients that are in the Thyroid Complete can actually make a difference. So that if somebody's on a thyroid prep and they've had Lyme's in the past, adding that to their protocol can actually help to keep that Lyme's in check so that it just stays buried deep within the body and allow our own immune system to go in and kill it.
So Dr. Len, just a quick question. You had mentioned earlier that a lot of the tests don't show if you actually have Lyme. So your recommendation was to really kind of look at the physical symptoms.
Yeah, you almost have to. I mean, if you've had a tick bite and it's been verified, You can do the blood test. I will test positive every single time. I mean, if I go in today for a blood test, I will show the IgG test will show that I've had it. If I do an IgE test, it'll show that it's not active right now, but it's there. I understand that. You know, I've got those immune markers in my system. Is the Lyme's bacteria active in me? No. Is it still there? And again, Mike and I were talking about this. No matter what anybody's done in the world of research against Lyme, the biofilm technology that Lyme seems to have keeps it from really getting annihilated. We can eliminate 99.9%, but that 1/10% still wants to bury itself somewhere in the body. So it's why it's extremely important, if you've had Lyme's ever, to have a protocol in place somewhere along with some of these preps, maybe just the reds, to help keep things in check and make sure that you have the tools available for treatment in case it starts to flare itself.
Oh, Fran.
Okay, Mike's got one quick thing.
Yeah, I would just like to add to that, you know, and Dr. Lisa, you can back me up.
There she is.
Yeah, now we see you.
There she is.
Perfect, right at the end. You know, clinically speaking, I know there's lots, as Dr. Len mentioned, lots of different ways, but the protocol that we've put together that Dr. Lisa's been doing, I would say 9 out of 10, it works 100%. They feel better and see relief. And kids, again, great for kids. We just, you know, we have the liquid options on most of these things. So we're going to get out that protocol for everybody to see that, you know, but Dr. Lisa, would you confirm that, collaborate that about 9 out of 10 people would get relief with this protocol?
Yes, 9 out of 10, definitely.
So pretty good odds, 90%.
So we do have a question to field right here. It's in the chat, but I'll read it for you, Dr. Len. What do you think about the cell gym technology that brings patient down to a hypoxic state to activate Lyme and then bring oxygen back up to kill it? Mark Hyman was recommending it for Lyme. Obviously, Rhonda is a big fan of EnerCoQ10 with extra EnerDMG. She had a friend with Lyme locally say that it's the only supplement, just DMG by itself, that has ever helped her with her symptoms.
Yeah, she sent me that the other day, and I had a chance to look at it and look at the idea of this, is that you actually lay flat for a period of time and they put a mask on you where it's going to control your breathing for a period of time. So it's going to take you into a state of hypoxia, then increase your oxygen levels very rapidly. That concept, understanding that, you know, just like nitric oxide, that oxygen seems to be the death march for Lyme's, that when you're going to do that systemically like that, through the lungs, pushing it into the system rapidly, I think can be highly effective. I think it's a great concept. For those that are really struggling, I think that could be a great way to start, but I still think doing that, I think, is critical as a first line, but also making sure that you're doing some of these steps in here. You know, you got to have some anti-inflammatories in place. You have to have SPMs. You have to have EnerCoQ10, because it's going to tend to want to rear itself back again. Because unfortunately, we can't get beyond 99% kill rate.
Wow, that's really interesting. So someone who's had Lyme's will always have it? Is that what you're saying? It might just be dormant in the body?
It's not dormant. Your body produces, it causes a very unique IgG marker in your blood. Okay, where the testing techniques, which are flawed, like I don't have active Lyme's right now, but they can actually look at these blood labs and say, well, you did. I don't know when, but you did. Well, what's that mean? It doesn't mean much of anything, except that I can verify that I did 8 years ago, but I knew that. But again, that's why I don't really, I hate to use the term, waste my time doing those kind of blood labs. You know, we know that the Western blot test was not that effective. So, you know, Mike and I talked about this in depth too. I think you got to pay attention to symptoms. If they have had a bite, start treatment right away.
And maybe just cover the things that you can do to kind of repel. You were talking about a couple different oils. I think you said lemon and eucalyptus. Is that right?
Lemon and eucalyptus, those two together used naturally. And it's not a lot. You know, again, when you study aromatherapy, you find that if you treat the soles of your feet before you put on your socks, before you put on your boots and go out into the woods, your body can absorb those essential oils if they're done correctly, systemically. And it can actually help to send out a signal that just stay away from me kind of
Well,
thing.
there you
So,
go, Dr. Lisa. Your lake weekends are saved, baby.
yeah,
I make a spray. I make an essential oil spray and sell it in my shop, and everyone loves it.
there you go.
I
Yeah.
need to come get me some. That sounds
Just
awesome.
I'll pick some up.
smells good, and just spray a little bit before you go out, and you're good.
Lemon oil and
Awesome.
eucalyptus. Yep.
Yeah, there's a
absolutely.
couple other ones I use, but I use those too.
Awesome. Well, I just want to thank everybody this morning. Dr. Len, thank you for always bringing it, giving us the research and science behind why these formulas work. Actually talking about how the natural way to heal is actually recommended, that
Yes.
our modern, traditional medicine doesn't have the answers. That is so cool to hear. I love when I hear stuff like that we're on the right path. Dr. Lisa, thank you for your own testimony and sharing with us. I love that we were able to bring this to everybody. And like Dr. Len said, we will be sending out this video because we had plenty of requests for people who said, I can't get here, I got patients, but please send me the video, right? So
Yeah.
thank you for being so gracious with your time. We'll get you the protocols. We'll
Yeah,
get you the
I'll send all
research
these over
links.
to you.
Thank you. The research links. I will do my best to decipher Dr. Len's still doctor handwriting to get you those protocols. And we'll make sure that you get all the research and the link to this. So thanks
Sounds
again,
good.
everybody. Have a great Friday, wonderful weekend. Sending you much love from Pittsburgh.
Have a
Take care,
happy, healthy
guys.
day.
Bye.
Bye.